Hi, everyone. Welcome again to our next panel, Horrors of the For-Profit Healthcare System During COVID-19, where frontline healthcare providers will be discussing how the system exploits both workers and patients and why Medicare for All is the solution. I'm Dana Baker, a Bernie Sanders delegate from California Congressional District 4, and co-organizer of this panel, along with Nina Baldwin, a Bernie delegate from CD45. After the panel, Nina will be hosting a Q&A session with our panelists. So please hold your questions and then use the raise hand function in Zoom when the panel ends. We'll also be taking questions from our live streams on Facebook and YouTube, so feel free to post there towards the end of the panel. So today it is my pleasure to introduce our incredible panelists who are all California delegates for Bernie Sanders. First, we have Dr. Bill Honigman, a retired ER physician and leader of Progressive Democrats of America, and who will be our moderator today. Next, we have Katy Roemer, registered nurse and California Nurses Association and National Nurses United Union leader. We have Kyle Thayer, paramedic first responder and physician assistant student. And lastly, we have Dr. Ron Birnbaum, a practicing physician from Physicians for a National Health Program. Dr. Bill, passing it over to you.
Okay, here we go. Thank you. Thanks so much, fellow California Bernie delegate Dana Baker and organizers, and everyone for joining this People's Assembly. I am Dr. Bill Honigman, a retired emergency room physician. I've practiced for more than 35 years here in Orange County, California, and saw over the years how healthcare in America became gradually more and more commercialized, corporatized, privatized, and profitized, treating people as commodities rather than living, breathing human beings. I saw resources cut back in the form of reduced staffing on overnight shifts, and increasingly more difficult for folks to see their own doctors or to follow up with their doctors after being seen in the emergency room. They would end up back in the hospital or dead, and obviously with lots of human suffering that could have been avoided. That brings us to the discussion at hand. Specifically, what new and horrific consequences are we providers of a healthcare product seeing, especially now exposed, as Assemblyman Ash Kalra said earlier, and now magnified by COVID-19. So for that discussion, we have this terrific panel, and we're going to split up our time. We're going to have the panelists speak for about 20 minutes. We have 3 panelists, so for about 20 minutes, they're going to speak on the first question is, what are you seeing out there? What have you seen on the ground before and after COVID-19? And tell us about your experience. And the second question will be, the second 20 minutes will be, how does that relate to what system changes you see as necessary to move away from the corrupting influences of for-profit healthcare? So with that, that gives us about 3 panelists, 20 minutes each for the first question. I'm going to turn to the amazing, awesome Katy Roemer of the National Nurses United and California Nurses Association. Katy, if I can call on you first to tell us what you're experiencing now, especially in the age of COVID.
Thank you, Dr. Bill. I appreciate it, and thanks to all of the people that have put together these panels and this whole People's Assembly. It's even though it just started, it's been amazing so far, and I'm really looking forward to hearing about the rest of it. I'm going to just start out by telling you I am stunningly pissed off. I live in a state right now of absolute fury, and it's hard to even express where nurses and other healthcare providers are right now in terms of this pandemic. We were struggling before. We were, short staff. We have, as Dr. Bill alluded to, we have been, commodified, and the for-profit healthcare systems have been stripping us of the things that we've needed to provide decent patient care for a really long time now. But this pandemic has absolutely laid bare the brutality of this system, and the fact that we are continue during the pandemic to be stripped of the resources that we need to be able to provide not just good patient care, but decent and even safe patient care to our patients. I think I'm representing kind of the inpatient group right now, where the people who are actually in the hospital taking care of patients. That's where I am right now. And I hope I can convey to you how bad it is, and how horrific it is to be a patient right now, not just as a COVID positive patient or coronavirus positive patient, but any patient right now. It is dangerous. All of us are unsafe. And we continue 6 months into this pandemic not to have what we need to safely take care of the human beings that are entrusted to us. We don't have the personal protective equipment. We're not using science. They've thrown science out the freaking window during this pandemic, so that no longer are we using the 75-cent N95 masks that you've heard so often about in the news. We used to walk into a room, put that we'd put that mask on, walk into a room, and when we walked out of that room, we would throw it in the garbage, because that's what science said was the safest way to protect yourself. And again, I'm just speaking of the N95. I'm not speaking of all of the things we would put on. We put on, depending on the circumstances, a lot more than that. But what we've been told during this pandemic is wear the mask for the whole shift, or put the mask in a paper bag and save it and use it later. I'm sorry, viruses don't decide to stay on the outside of a mask while it's sitting in a paper bag. It's all over that mask. So now when I put that mask back on, I'm putting that mask onto my face. Or if I'm walking into a room and I walk out of that room and I keep the mask on because I have to reuse that mask, all that stuff can be on the outside of that mask. Right? All the virus can be on the outside. So when I go into the room, I'm basically making a decision now. Do I protect myself or do I protect the patients that I'm taking care of? We should never be placed in a situation like that. We have been utterly failed by the people that are supposed to have taken care of us. Nurses and other healthcare workers, we sign up to take care of sick people. We know that there is risk involved in taking care of sick people. And we take that on. That risk is something that we take on. But it is the obligation of the hospitals that we work for to give us everything that we need to be safe. And they have failed to do it. Not only because they have failed to give us the personal protective equipment, they failed to give us the staffing that we need to take care of people. They've actually cut staffing in the middle of this pandemic. They've cut staffing. Like the night ICU nurses in my hospital where I work don't have someone watching them. So that, right now, hopefully I can explain this in a clear manner, but when you are in the intensive care unit and you have COVID-19, you often have the pump that is giving you life-saving medications to keep your blood pressure elevated enough to keep you alive. Those pumps are outside the room in order to save the personal protective equipment and not have people have to go into that room. But let's say a nurse goes into the room to actually do the assessment on the patient and something happens where they have to adjust that pump. Somebody has to be outside that room to do that adjustment, or they would have to go back out, take everything off, adjust the pump, put everything back on, and go back in the room. But there's not those people a lot of the time to do those adjustments outside the room because the freaking hospitals don't want to pay for it. That is appalling that we would be in that situation. To cut people, not give us, these corporations are making so much money and they don't want to put it toward patient care. This is, nurses really live right at that nexus. And, Dr. Bill, tell me if I'm running out of time here. Just like hold up your hand. But we live right. Yeah, go ahead, Bill.
Yeah, you need to wrap up
Okay.
this segment, but thanks.
Okay, I'll just finish up with a couple of sentences. Nurses live, the care that we provide, we see everything at the end point of what all of these policies that we're talking about, all of the injustices that we're talking about, we see the end point of that when people get sick and can no longer hold it together anymore because they live in neighborhoods where they don't have the resources that they need, because they're victims of a racist system in this country and don't get the either resources or health care that they need, and they are under the incredible stress of living in a racist society. We see all of the people who don't have access to health care and can't pay for it. And we understand how that works because we see those human beings, and we are forced to make a decision right now between taking care of them and taking care of us. And our employers know that we're going to take care of them. And they're exploiting the fact that they know we will do that. They will go into those rooms whether we have the right equipment or not. And they're exploiting the fact that we will do that. They know we'll risk our own lives. They know we'll risk our families' lives. They know we'll risk, unfortunately, the community's lives. And they're taking advantage of it. So that is the worst, kind of level of exploitation that I hope everyone understands, that puts not only us at risk, but every one of you and everybody in the community at risk as well.
Absolutely. And Katy, I know we're just touching the tip of the iceberg here because, as we talked about before, they're not even testing everyone for COVID in the hospital. I mean, can you imagine that? We don't not only have, universal testing in the population, even in the hospital, we have no idea who else is asymptomatic walking around with the disease. So our hats are definitely off to you. You are definitely on the front lines. Let me bring up another frontline provider, my good friend, Kyle Thayer, so, paramedic and first responder. Kyle.
Howdy, folks. My name's Kyle Thayer. I'm a paramedic down in San Diego. I've been in emergency services for the past 12 years. And for the last 6 of them, I've been the lead first responder paramedic running 911 calls in the city of San Diego. And I've had a long experience with the horrors of the privatized healthcare system. In fact, I've been spending the last few years going back to school, getting extra education. I'm in the process of becoming a physician assistant student because the horrors of the pre-hospital privatized healthcare system. Matter of fact, the city of San Diego and many other cities across California and the nation are their 911 systems run by a company called AMR. That company is owned by the Koch brothers. So literally private equity is trying to squeeze every dollar out of your family's emergency care, and it's unconscionable. And these problems have only actually gotten just worse now that COVID's going on. A couple of examples that I can give you off the top. I don't want to take too much of everybody's time, but just like Katy was saying before, we're reusing our N95 masks. This is something that we've always thrown away right away if we suspected a respiratory-borne illness. Now we're being asked to wear them all day. Even worse, there's just no consistency in the science and what we're expected to do. For instance, when I'm breathing for somebody, I use a bag and I have something connected to their face, either a breathing tube or it's a mask. And for a short period of time, we're told every time you're doing something to that effect, you need to use this filter. And the filters were there for about 3 weeks. They all got used because there was a lot of respiratory-borne illness. And then they just disappeared. And now we're supposedly getting exposed to all the things that are coming out of the breathing tubes and coming out of the person's mouth. And so COVID, and the crazy thing is COVID has actually reduced 911 call volume. And a company that's owned by the Koch brothers is not going to let a good opportunity like this go to waste for them. They're going to cut this down to the bones. And as call volume rises, they are not going to be increasing the number of ambulances on the road. So there's a million things I could talk about on the horrors of the private healthcare system. And there's a million ways we can fix it. And well, I have a feeling we've got that coming up. Thank you very much for your time, everyone. Dr. Bill.
Thank you so much, Kyle. And I know, it's such a travesty. I mean, to be asked to walk into the fire, is bad enough. And that's what you and Katy are doing. I'm going to bring up Dr. Ron Birnbaum now. Ron is a physician in kind of central LA, sees a lot of publicly financed patients, right? Medi-Cal, which is Medicaid, of course, across the country, and Medicare patients. And so in your practice, Ron, what are the challenges of COVID-19, and especially are you seeing those healthcare inequities that we talk about with social determinants of health and that kind of thing in your population? I'm sure you are. Would you tell us about that, please?
Sure. And I also want to thank all the organizers for putting the work in this, and everybody who's come together to educate themselves here and to spread word about the problems that we have. And, you know, one thing you said in the beginning of the question, Dr. Bill, was things like before the pandemic and during the pandemic. And they're related, but they are definitely related through a system that is perverse and evil. And it's an apartheid-based system. I think that's become increasingly clear over the years. And it isn't ultimately based on the health of human beings and the wellness of human beings. Its incentives are aimed primarily at the earning of money, despite the efforts of individuals within that system, people like Katy and Kyle, to navigate that and do their best. So just to give people just a sense of what I do, I mean, my specialty is dermatology, but I work in different settings. So I work a little in a county hospital, Harbor UCLA Medical Center, and see poor, often undocumented patients in Medi-Cal and Medicare. I work in a federally qualified health center, teaching family practice residents and seeing patients, largely undocumented population there, also people on Medi-Cal, as you said, Medicaid in California. I work in a small community practice I set up where one of the few people who will see patients with Medi-Cal, and therefore most of my patients are Medi-Cal because I'm one of the only people who see them. And then I do work in one sort of more typical practice where I see people who get insurance through their work, often through the work that their unions have done to get them that insurance and others. And in all the places where I work, I see some patients on Medicare. And so I've been a witness to a system over many years that just doesn't care for human beings equally. And then the virus found us in a state where it differentially, and this isn't the only health condition that does this, but it differentially infects and kills people who have worse baseline health in a system that's been an apartheid-based system and gives people worse baseline health. So that's the sort of like the big broad strokes things and sort of view that I kind of wanted to share where I begin, but there's a lot of specific details in there. And there are a different set of details maybe than Katy's because I work in outpatient settings, or Kyle's who's working out in the field. So let me stop there for intro.
Okay, great. Well, thank you. Ron, actually, you were kind of shy of another minute or two, so I'm going to ask you specifically as regards COVID-19 now, how are you seeing the problem, exposed and magnified in providing care for patients in your setting?
Well, actually, I'll point out two things that are very specific to my experience in the last several months. And one speaks to some of the challenges right at the beginning of the pandemic in March, although many of them have continued. And another part is something that's sort of emerging horror and catastrophe. Horror is an important part of the title of our event today. So one was that because there's so few people who do what I do, who will see people who don't have much, the people who do it have tried hard to expand or help more people than we otherwise would. So I had some experience with doing telehealth as a means to expand healthcare or my specialty's knowledge in the social safety net before the pandemic. So right in March, when everything was shutting down, we continued to have a sense of wanting to help people who are in some cases who, without exposing them to coming to the healthcare settings. I mean, Katy can't manage event in, over telehealth, but I can do some dermatology over telehealth. So one of the first things I did was all these different places that I worked, because I had some experience in this, converting our healthcare system to doing Zoom healthcare, just using the same platform we're all meeting on. And right away, I've never had such an explosive view of the American digital divide and our lousy kind of healthcare system, and how that sort of played out in differential access. So, and this is an issue for kids in school and everything. If you don't have like a computer with a camera, then it's harder for me to do that particular thing for you, right? And guess what? The poor people in our country are less likely to have that stuff. But the other thing that was really galling is that all these places where I'm trying to work, we're just like trying to stay afloat. And to do that, we have to get paid for providing care. And providing care for telehealth is has a special set of kind of reimbursement characteristics. So one of the first things I was doing in March, when everybody else was like running around with their heads cut off like a chicken, was talking to my congressperson and the CMS, trying to lobby the people in Medicare to make those rules more supportive of people who wanted to do digital. If there are seniors, for example, on this call, which there are, many of whom are like scared to death, reasonably, of going into healthcare settings, and they want to get help from their providers through a digital means, on the phone or through Zoom, they need that. So Medicare was about to finish this point, Bill, and I'll be done. Medicare did respond to that, despite being run by like total assholes that are in there. They still responded to that. But then every single little insurance company decided they had to have a long-term approach and evaluation to whether they were going to pay for this stuff. And that speaks to the fact that they don't think about providing care. They often think about not providing care because it saves them money. And their bottom lines show it right now.
That's right. That's exactly right. Well, thanks, Ron, because that's a perfect lead-in for part two. And we'll go around the panel once again, which are the system changes. I mean, full disclosure, all of us, including myself, we all voted for Bernie Sanders for the convention, right? We're all Bernie delegates. We voted for Bernie and against the platform because it didn't include Medicare for all. So obviously, Medicare for all, has to be what I would think all of us agree on as a fix. But let's go back to Katy. What do you think in your experiences, Katy? They're on the front line in your environment. How do you look at Medicare for all or other fixes that we need for your situation and your patients, especially?
Yeah. So first, I just need to back up just a little bit. I was so excited about being pissed off about what's going on in all of the hospitals. I didn't say, basically, I've been a nurse for 25 years, and I am lucky enough to be part of a union that fights like a dog for us, and that allows us to, and that's National Nurses United here in California, the California Nurses Association. And they have done a pretty incredible job of putting together resources that we can put forward. So, and first and foremost, I just want to set the stage for what I'm about to say by saying we have to get profit out of healthcare. I don't care whether you're fee for service. I don't care whether you're an affordable care organization, very different ways of making money. And it doesn't matter because both of them do the same thing. They screw the patients and they screw the healthcare providers in order to rip off profits from them and keep them for themselves. And when you have something as critical of a public good, I mean, for God's sakes, libraries are free in this country. Right? Garbage collection is, no, that's not. Libraries are free in this country, but we can't give health care to people even when it's cheaper. So I just preface it with that. I am absolutely not interested in hearing anything about incrementalism, because I can't, people are dying, and they're dying right in front of us. And some of them don't need to die. They're dying because we're not giving them what they need to get the care that they need. That said, there is more that we can do. One of the things that we're working hard is supporting the HEROES Act, which would give our patients some economic relief. I'm stunned to hear that Congress walks out for their break without any relief for the people of this country, in the middle of just a collapsing economy, and people who are going to be homeless, and people who are just millions of people losing their health care every single day because of the loss of their jobs. This system is ridiculous. It's inhuman. So the HEROES Act will give some economic relief. It will also put in place the Defense Production Act, basically, which will force the production of PPE, the personal protective equipment that we need so desperately, that has not happened yet, 6 months into this pandemic. We also need an enforceable emergency temporary standard on infectious diseases from OSHA, all of which we are getting support in the Democratic version of the HEROES Act. So those are some things, but I also just want to talk a little bit about the kind of dogfight that we're having in our facilities. We are having multiple days of action, and we have done, at least I'm going to talk about my facility just for a moment, but this is being echoed in facilities all throughout the state and the country. We've done multiple actions to demand and shame the hospital in front of the hospital to demand for the PPE that we need. When we were in the height of the George Floyd protests, we did a BLM action in front of our hospital. I work in Oakland. We have an incredibly diverse workforce in Oakland, and people who don't always show up for the union actions came out for that because they were so grateful that we were taking a stand together. And most recently, we did a national day of action for getting the staffing that we need. It's all tied into one, but we're appalled that they're going after the freaking ratios in California, which is the only state in the damn country that puts a minimum standard for how many patients a nurse can take care of. And the dang hospitals, and they're, colluding, the hospital industry and the hospital associations and the state and the federal government, but mostly the hospital associations are colluding with them to rescind the ratios in a pandemic. So you think about those ICU patients in the room that have the, pumps on the outside that are ventilated. The patients are sedated. They're often on their stomach. We call it proning. They need one-to-one care by a nurse. Sometimes they need more than one nurse and respiratory therapists and others to be in that room. The state standard for ratios to have one nurse at least for 2 patients. They want to get rid of that. So they want to start giving ICU nurses with these patients up to, 3 or more patients. Like, you are going to have dead people because no nurse can take care of those people the way that they need to be taken care of and help them survive. This is a deadly, deadly disease. Once you get intubated, once you are in intensive care, you are very, very likely not to live. Your statistics are not good, but you're really going to be dead if the nurse doesn't have the staffing to be able to absolutely monitor you minute by minute. And absolutely. The fact that we would even have that be a question right now is so appalling. So we're working. I have some photos later. I don't know if they'll be able to pull them up, but of some of the actions that we've done that I hope to be able to show you, but we'll see.
Sure.
Thanks.
Sure. Thanks, Katy. So let's, we'll go to Kyle next on the same question. I agree. I want to say before, Kyle, that I agree with Katy. There is no middle ground when it comes to human life. And I know as a principle of disaster management in medicine, that what institutions are supposed to do is to upgrade in the case of a disaster. You're supposed to turn regular hospital beds into ICU beds, right? And or like convalescent beds into hospital beds with that kind of care, that kind of staffing. So Kyle, I'm sure you've seen the same issues in the field as a first responder. where you were given far too few resources to deal with that kind of upgraded disaster management, that we really are in now and should have.
Absolutely. I mean, half the time, a 911 system, it's tough to predict. There's ebbs and flows, and you kind of want to be prepared for everything. And there is definitely times pre-COVID that I've felt that we didn't have the resources. We needed to take care of the people that we had in the city. I also wanted to kind of just reaffirm what Katy said. We need to take the profit motive out of our healthcare system. I've literally had patients that have gotten into a motorcycle accident, have broken legs trying to drag themselves off the freeway because they're worried about the ambulance and hospital bill. And it's just absolutely unacceptable. When people need healthcare, they should receive healthcare. Seems like a pretty simple idea. Another thing that I think we need to do with post-COVID, we need to be encouraging every legislator to be encouraging the executive branch to implement the Defense Production Act until we have all the supplies we could possibly need, so that every time I go into a house that has 4 different people in it, I wear one N95. I don't know if any of those people have COVID on them. Well, as soon as I leave that house, I should take that mask off and I should be grabbing a new one. We need to implement the Defense Production Act so that every ventilator, every mask, every resource that we could possibly need is taken care of and provided. And as like I said, as Katy said, the profit motive in healthcare is a cancer, and we must fight it at every turn. As Dr. Bill said, no middle ground. We need to make sure. Just one last thing. One of the things that I've been working on in my position as a delegate, huge honor to be a delegate representing for Bernie Sanders. I've implemented asking the Democratic Party to implement reforms that we support publicly run 911 systems. When you call 911, it shouldn't be somebody with a profit motive looking to make a buck off of your emergency. So I've authored some changes, and I'm going to continue to push for that going forward. And I just want everybody to be cognizant of what the 911 system in their town looks like. The police and the fire department will usually be run by the city or the county or the municipality, but your ambulance could literally be trying to cut as few ambulances as they can, so that when your grandma has a stroke or a heart attack, it's going to be longer response times and they have worse outcomes. So please just pay attention to that in your community. And again, thank you so much for all your time.
Oh, thank you, Kyle. So, and I got to tell you, I 100% agree that for-profit takes resources out of the system that could be applied to that need. So it's actually immoral to have for-profit involved at any step along the way in treating people. So Ron, I'm sure when patients can't get to see you, whether it's telehealth or whatever, if they're intimidated by costs and maybe ICE or something, to seeking care, their problems are made worse, right? So things will get worse and require even more resources to deal with that. So how are you seeing from your perspective as a practicing physician the fix for the problem for the state that we're in now?
Well, we need Medicare for all. And I mean, there's maybe a couple of intermediaries that I don't consider sort of incremental things, but sort of emergency type things or facilitative things like the Healthcare Emergency Guarantee Act. I would like to see a stronger move to make it so that our state could do Medicare for all. But this it's been a wrenching time, sort of, as a physician and as an activist and somebody who cares about like justice and politics, because like March was a month that illustrated so profoundly how wrong the direction of the Democratic Party has been since LBJ and the passage of Medicare and the Civil Rights Act and that stuff, like how far off we've gotten from that, illustrated that so profoundly. And yet the choices that were made, that the public and Democrats and et cetera made in March, and then that have been translated into some of like the platform fights and things like that that we Bernie delegates have been involved in, are as if they completely ignored those profound lessons. And so that's been like an enormous disconnect. So I'll just give you a couple examples of those things. And so, you know, for example, for many years, Medicare for All was in the Democratic, or think units kind of real universal healthcare was in the Democratic Party platform. In the early 80s, it found its way out. And then, you know, and in a state like California, although really even in a state like South Carolina, which voted for Vice President Biden, if you ask the people who were voting, Democrats there, do they support Medicare for All? Overwhelmingly so. And so to the extent that Sanders lost or Biden won, in my view, that was a loss, I guess, an electability argument, but not a policy argument. And yet the folks on the platform committee pursued that like as if there had been a policy argument that was won. They got came to the wrong conclusion from what happened in the primaries. One small fight, I'll give you an example of that, and some people here were involved in that, was we said, okay, Joe, you won this election, or it looks like you did, and you said you would veto Medicare for All, but you know, in California, Bernie won big and he beat you in California. And we want to do Medicare for All in California. How about that as kind of a unifying party thing? Let's facilitate a state like California doing Medicare for All, knock the barriers down to the waivers and the federal stuff. That would be a great sort of unifying type move. So there was some language in the draft platform that said, yeah, we should, you know, we should help the state, you know, well, we should do, maybe the states could do something like that. We said, no, we wanted to say like a state can do single payer Medicare for All, the government will support it. If you don't want it somewhere else, okay, hopefully you'll learn from us in California. Even that was sort of torpedoed. And so to me, there's a couple conclusions. And one, we have to take action like a lot of us did. We said no on the platform. But I think that in the last few weeks, we figured out that the election for 2024 has already started. We can't wait for all that stuff, but that the election has begun, even whoever wins the election this fall.
All right. Okay, thanks, Ron. Thanks for that highly political answer to the question, which I you know me, I'm a political junkie. I really appreciate it. Dana, I think we're turning back to you for questions from the queue, right? So what do we have, another 15, 20 minutes to take some questions? And then I will be as fair as I can to distribute the questions among our panelists.
I'll be taking on the questions, Dr.
Oh,
Bill.
Nina, there you go.
Yeah, no
Hi.
worries.
Thank you, Nina.
Yeah, no problem. So we're going to go to question and answer right now. And what that means is if you want to ask a question, there is a raise hand function. If you're not sure where it is, if you go to the bottom of your Zoom, there is a participant section. Click that, and next to your name, there's a way to raise your hand. Also, if you're on the phone, you can raise your hand by pressing *9. You can also ask questions in the chat, and we will try to get to your question there as well. And lastly, also, to get to the chat, you can get there by going to the bottom. There should be a chat section as well that you can click to see the chat. And let's make sure our questions are only 1 minute long, because we want to make sure everyone has a chance to get their question asked. And let's all make sure that these are questions and not just, you know, I know we all have our different things we want to talk about, but we have our panelists on here, and let's make sure that they can answer questions. So go ahead and raise your hand or go into the group chat to ask questions.
And thank you, Nina, for reminding folks to please try and limit your questions and comments a minute or two, and panelists as well. We could try and keep your answers short, and then we can get to more of the questions. So thank you.
Okay, so the first person I have is Paul Marchand. I'm going to go ahead and unmute you.
Oh, a fellow retired ER doc, right?
I'd love to say that, but Doc, you know, I've got you by a year, and for practice length, and the other sad thing about it is I probably will be retired after today for even participating in this, because I doubt if anyone's ever going to hire me again. Anyway, what I'm going to say is, have we looked at any of the systemic ills in terms of the emergency room? I know you alluded to staffing. This also alludes to the staffing in the emergency room. We've never had ratios because the immediate problem in the emergency room is we were thrown out of the ratios right away, which means that most of my nurses and my colleagues have spent their entire existence, and you can amplify this, in a state of exhaustion. What I want to do is see if we could address a structural approach to changing medicine in California in terms of trying to eliminate the huge growth of hospital administration and hospital costs associated with that.
Right.
And then there was some question, actually, single payer.
Thanks. That's plenty. So thank you, Paul.
You're fine.
We do want to keep the comments short, but it's a great question. I would just say that, you know, over the years of my experience, when I did my training in emergency medicine, they taught that staffing should be for peaks, right? Peaks in volumes and acuity. So you're always ready for the most and the worst that walks into your emergency room. And over the years, we started seeing them, you know, get rid of people that they saw sitting around. And so I think, Katy, if I can go to you, that's a struggle that the nurses have been fighting for a long time as well, is the staffing issue in particular. And I know, Kyle, you've experienced that in your setting. So Katy or Kyle, you want to add to that?
Well, I just do want to say that we do have ratios in the emergency room, and there, so we do have, for nurses, we have ratios. We did win that as part of our ratio fight. So, you know, thank God for that, because if we didn't, we would be in so much deeper trouble than we are. But I do want to say that the hospitals are cutting staffing in the emergency room during a pandemic. So there's just no shame. There is no shame, because it doesn't matter. Right? Like ultimately what's happening is we're being set up to fail, because if you don't have enough people to provide the care, you can talk about, you know, what you need for ratios. Ratios are the minimum, right? You're not supposed to only be at ratios all the time. What you're supposed to be doing is looking at the patient care needs of the patient and then providing what is needed to be able to take safe care of them. But if you're cutting the staffing during a pandemic, you're making a decision not to do that. So, and that's what's happening. And I don't think it's even, you know, I mean, we are just we fought really hard to get those ratios in place. We're fighting really hard to hold on to them. But it isn't just us that deserve ratios, right? Like everybody deserves some sort of a ratio so that we all can give the care, all the providers can give the care that we need. But, you know, they're going to fight us tooth and nail for that. But so we do have that. We're trying to fight to hold on to it, and we're going to continue that.
And it's also prevention, because if you have enough staff, it keeps things from escalating and costing even more in the way of resources. So it will end up costing less. So Kyle,
very, very similar. You know, I'm very glad to hear that the nurses won ratios. Unfortunately, the 911 system seems to be the wild, wild west. They get to make up the rules as they go along. And, you know, sometimes we have enough to respond to a grandmother having a stroke within 5 minutes, but there's been many, 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 more than I can count, where I've responded to a CPR down at the border, and I'm 40 minutes away in North County, San Diego, because we simply just don't have the resources during peak times. And the company, all they care about is, well, do we meet compliance at a certain percentage of the time? Are we making our response time 90% of the time? Well, if so, then we're in compliance, and, you know, a couple people died. Oh, well, that's how they look at it. And it's really immoral and disgusting. We need to, I mean, I hope that, I'm on the way out of the pre-hospital system and going into the emergency room myself. And I plan to keep fighting for EMTs and paramedics, but I hope that we can get a ratio and a minimum amount of ambulance hours per population and density and that kind of thing. So I know that fight and that struggle, and I'm glad you have ratios, and I hope that you can continue to keep it, even though they're going to do everything they can to probably try and take it away from you.
That's right. And those decisions are being driven by market forces instead of by the will of we the people. So I know you agree with that, Ron, too. If we could go to the next question, and probably we'll catch Ron for the answer, but let's see if that's okay, Ron. We'll ask the next person for their question.
Okay, next we have is Kayla Asato. And let me unmute you 1 second.
Hello?
Okay,
Cool.
go ahead.
Awesome. Of course, I'm here, so I support Medicare for All. But I was wondering, how do we want to enact that for California? I know that, like on the organizing side, so I know that Massachusetts has several organizations based there that have been pushing for Medicare for All at either a national level or so specifically at the state level. And they are trying to lead on healthcare reform for Medicare for All. And they are pushing it, they have pushed it through the state Senate, and they have trouble with the Assembly and the Governor's Mansion. So I was wondering if we had any strategies for enacting the same kind of thing in California, partnering with them or other national organizations. What's the strategy there?
Great question. Thank you, Kayla. And so, Ron, this seems like a T-ball kind of question for you, being an organizer with PNHP, and you've got your excellent partners like NNU and PDA, and all these groups working on it. What do you see to tell Kayla about this?
Well, one thing, Kayla, is the session before this, there were some folks really talking about that in detail. So if we made available the recording of that, you'd get a more detailed answer. But the short of it is that there are a whole set of similar organizations, I would say, in California, including some that are national organizations. So and from a physician standpoint, I'm part of Physicians for a National Health Program, which has a California state thing and a Los Angeles or a Southern California chapter, for example. There's a ton of activists from Healthcare for All, Los Angeles and statewide, who are on this. And there's an organization called One Payer States who has some of their leadership is on this call. And so I don't think there's a lack of organizations. There's some work on new legislation for California, but there's a larger project, which is both making it clear to the broadest set of communities who are, particularly the ones who are least well served by our current system, what are the paths that are the best way to reform our system. And then there is also political tasks of fighting, because see, all that profit and money is tied to a political system where that money gets disproportionate representation in our legislatures. If you try to do a ballot initiative, they can spend disproportionate money killing the ballot initiative. So there is, don't be despondent, but it takes public movements to overcome that money, for sure.
All right, and let me go to Katy, and I'm just going to mention between you two, because PNHP and National Nurses United are the big dogs. There's no doubt about it. But us little dogs in Progressive Democrats of America, PDA, we've been having weekly healthcare emergency town halls. You're welcome to join us. You go to our Facebook page, PDA Healthcare. Join us for our weekly town hall meetings. And Katy, NNU has some major organizing going on, like later this month, right? Like after the convention, day of action, etc. Oh, you're muted.
So 22nd, we're having a National Day of Action for Medicare for All. So everyone is invited to participate in that. You know, I mean, we've been in this fight along with our allies and the rest of the groups that have already been mentioned for decades. And we have done all of it, right, in terms of, you know, SB 562 and putting forth a state initiative to try to get that through, and then going, you know, the focus has really been more recently national. We've done, you know, ongoing distributive organizing to really get people educated at the grassroots level, because, you know, it doesn't, you don't get a movement and you don't get 88% of the Democrats supporting Medicare for all and more than 50% of everyone supporting Medicare for all unless you've done the deep educating of people about why it is in their self-interest to support it. And that is what we have really continued to do and will continue to do to educate people and to, you know, push this movement along. So a lot more to come. Again, the 22nd is that National Day of Action for Medicare for All. There will be many more details to come, and there'll be, I mean, again, there will be actions all over the place that you can sign up for and participate in. So
I love it. And from the feminist movement, I think it was that they coined the term raising consciousness, right? So raising awareness is so important. The town halls, the movie showings, the living room discussion groups, you know, once we get back in our living rooms, again, you know, small group meetings and stuff, and especially supporting those local candidates who get it, who understand that their cities and school districts will save money and save lives and a healthier, happier workforce. So I think we have time, don't we, Nina, for another question or two even? How are we doing on time?
Actually, we're doing great on time. It turns out we have a little additional time.
Sure. So if anyone else would like to raise their hand, you know, while we're going to the next question.
Yeah, if anyone, you know, people feel free to keep. We want to hear as many voices as possible. We love to have a large amount of people get to have their question answered. Right now, I do have a David Mandel. I'm going to go ahead and unmute you.
Thank you. Hi. Stop me if you already covered this. I came on a bit late to do another meeting, but I would just like the speakers to think beyond the current struggle a little bit, because what all the current bills advocate is something like the Canadian system, where there's a single payer, but healthcare providers are still private. And I think that there's still potential problems with that, because, you know, not all of them are like you, and some of them are going to want to maximize their profits, and that's still problematic. So the two places that I know of, I'm sure there are more, where they have a fully social system are UK and Cuba. You know, Cuba seems to work pretty well. In fact, they have enough surplus to help the rest of the world. And the UK, nobody dares advocate for getting rid of the system. Everybody loves it, though under neoliberal governments, of course, they can erode it by cutting the funding for it. So I just, you know, what do you think that eventually we should aim for that and move beyond the kind of Canadian system that the current bills advocate for? Thanks.
So thank you, David. Great to see you. David Mandel is he's a force of nature, has worked alongside all of us for peace and social justice issues inside the California Democratic Party. Great to see you. And kind of a wonky question for this group. I would just say, as also I'm a member of Democratic Socialists of America too, and I believe that any condition of human need should be socialized, because like we said, when you take profit out of it, then that removes resources that could go to applying it. And you don't have to look any further than our VA system, right? Veterans Administration is fully socialized. The government owns and operates that, and their outcomes are excellent. So Kyle, you had your hand up.
Yeah, I just kind of wanted to say, while I completely agree with the sentiment, I personally am careful when I'm talking about that issue. I like to try and keep the conversations more towards distribution of our own money and how we're paying for healthcare services. I find it's easier for me. I work in an ambulance with Second Amendment Republicans all day, so I'm having kinds of conversations where I'm trying to hey, nudge people over to my side. So I get some pushback about the VA sometimes, but I am obviously all for a UK style health system. It seems to work very well over there. People absolutely love it. And I do, like Dr. Bill said, the profit motive in human need, whether it be water, internet, or healthcare, should not be part of the equation. That's personally how I feel. I don't know if that's representative of the panel.
Yeah, just to chime in for just 2 sentences. I mean, the thing about Medicare for All is it is immediately recognizable by people. And you've got to get a system that is recognizable and that people can support. And we've had such a heavy lift to be able to push for Medicare for All. If you allow people to kind of levy that, socialist label against your system, I mean, I love the VA too. The VA is great, and it's truly a socialist, so-called socialist system. But realistically, here in the United States, doing a Medicare for All, expansion, an improved Medicare for All, is probably a more likely lift.
Absolutely. So, and Ron, I don't know if you had more to add to that. I would just chime in that.
Pretty much agree with that, but happy to talk to you about that too, David, if you ever want to get.
Yeah, the lowest hanging fruit, really, in the political sense, is big pharma, where you've even got Republicans on board for lowering drug prices, right? But next, by all means, the most egregious purveyor of waste, fraud, and abuse is big insurance. So that's who we're going after and socializing that part of the healthcare system at this point. We'll go after hospitals and doctors and after that. But let's start with big pharma and big insurance. Would be my answer to that. So can we go with the next question? I think Paul had his hand up, but I think we should give it to folks who haven't been able to ask theirs.
Sure.
If that's okay. Thanks.
Yeah, we can do like a progressive stack, and we'll
Right.
have people we haven't heard yet, and then if we have time, we'll go to people a second time.
Thank you, Paul.
Okay, so I'm going to go to Andrew. I'm going to go ahead and unmute you right now.
Hey, hi. I guess mine is a big strategy question. I've watched the debate go on for quite a long time, talking about the horrors of our medical system and the disasters, and of course it's become even more obvious under COVID. But strategically, I often think that talking about the horrors does not actually motivate people to action. I think Michael Moore in his film Where to Invade Next kind of got that a bit when he showed systems that were working. And I'm wondering what you all think about whether we should shift toward actually looking at a kind of a more utopian view of how healthcare should be as the way to motivate folks, because most people already know their healthcare is a disaster and feel very unconfident about it. So that's my question.
Good question. What do you think, panel? Who would like to go answer that first? I saw Kyle's hand first.
Yeah. So, oh shoot, I just spaced my thought. What was the general point of the question again?
Are we looking more for how good
Oh, positive or
be?
negative?
Right.
Okay. Right. So I know for me, I use a combination of both. I know that when I tell people the story of the guy with the broken leg dragging himself off the freeway because he was scared of the bills, that seems to have an impact on people. That does mean something to people. But absolutely, when I talk about how in Canada they submit something to the health service and then it's approved because a doctor decided it was medically necessary, both of those arguments can work, and especially used in tandem. I know for where I'm at on the ambulances is like, do you think a private company should be deciding how long it takes an ambulance to get your grandma help? And pretty much everyone I work with then breaks down and says no. And I'm like, well, do you think that a private company should decide whether you get to get a CAT scan? And so I use both sides of the argument is how I go about it.
Excellent.
Yeah, this is Katy. I would say it also depends on who you're talking to. I mean, gauge your audience, and who you're talking to is really the critical factor in how you do it, right? If you're talking to business people, show them the movie Fix It, right? It talks about the business case for Medicare for all, and how businesses will actually save money, and how in Canada the businesses are the people that defend their medical, in effect Medicare for all system as much as anyone. So really dependent on who you're talking to, whether you would use a fear-based tactic. I don't even know if I conceptualize it that way, to be honest with you. I just try to gauge what people are not understanding and address that.
So actually, Andrew, I do agree with the answer, which is that movements at some level are about one human being talking to another human being, and that's as special an individual as that sort of movement at a human scale, and no more so in this. So in other words, actually, there's lots of people who don't know how horrible the American healthcare system is. There are a lot of people who don't interact with it very much. They have a job, maybe they have pay a premium that they wish was lower or something, but they don't have that much, and every so often they get this and that. And so there's lots of people who don't see what's wrong, and then you sometimes see that reflected in the politics. So when you have like Joe Biden say and maybe persuade people that like all these people love their employer-based health insurance, that resonates with some people, and so some of it. I mean, and this is like going back to part of the original thoughts of the panel, which was like, what are some of the things that we're seeing right now? So at that office where I work in Burbank, I take care of a lot of people who work in the entertainment industry and get their insurance through their union, like through a guild or through a union. And a whole bunch of them are facing a new horror they've never experienced, because that industry has shut down, like production has shut down almost completely. And in many of those cases, their eligibility for their insurance is based on having worked in what they've done. Now, for people trying to break into some, like on the talent side, that's always been a struggle, right? Which is you have to decide, do you want to follow your dream? And we absolutely have a dream-killing healthcare system. It's like a separate topic. But I am seeing people who are newly encountering the horror of this system right now. And I'm seeing it in their eyes in front of me in the clinic in Burbank.
True that. So I did want to, because I think we only have time for one or two more questions, but I just wanted to point out in the chat, very, very sagely advice from Dr. Don McCann, who's Senior Policy Advisor for PNHP, who's with us today. He says, remember, when we already have the ideal policies and the politics are wrong, don't change the policies, change the politics. Couldn't agree more. So thanks, panel. Nina.
Okay, yeah, so now we have Margaret. I'm gonna go ahead and unmute you.
Hi, so I live in California, and I apologize too, I didn't get to sign on till 4 because I was in another meeting, but, and so maybe you've already talked about this, but we have this Health of California for All Commission going on here that they have a consultant that's it basically runs it instead of the commissioners running it, and it's very biased towards industry. And so my little group, which is Healthcare Action Committee, is trying to make connections with the press to see if we can get some muckrakers in there to expose this commission a little bit. But what I'm missing is one of the commissioners who's a very strong advocate. Her name is Carmen Consti, and she's been great. And she wrote a long dissent to the analysis that was made by the consultants on the current state of affairs and how to get to the goal. And I need that document. So if anybody knows where to get it, if you can put a link in the chat or tell me where to go.
Okay, cool.
Yep.
Thanks, Margaret. Katy, do you know if we can get a hold of Commissioner Comste's analysis?
I mean, I can ask, but I'm sure that there are people here that were actually on the I mean, that was talked about, I think, in the last panel, right, where they were talking about the response, and there may be a quicker way to get it than any way that I might be able to get it. So does anybody have access, you know, now that actually was working on it?
There was a post in the chat to her previous comments to a previous draft, but then she also wrote one in response to the final draft.
Okay, Margaret, do you have my email? You're welcome to email me and I will help you see if we can track it down.
Okay, I don't know if I do, but I think I know I have Mike Fox's. I'll ask him.
There it is.
Okay.
Okay, thanks and thank you very much. We have time for another question, Nina?
Yeah, actually we have until, well, I think we have a little bit more time. So let's definitely go to another question. So there was actually a question up in the group chat and I want to make sure that we can get to it. So it was, how many healthcare professionals are for Medicare for All? If there is not that much, then pushing a UK style might not be that much harder, So I guess they're trying to think, like, if depending on that, can we push a UK style healthcare system? Can you please answer that?
I know the answer, but I'm going to go to our panelists and see what
Bill, you can answer statistically. What I will say is if it were based on nurses wanting Medicare for All being the thing that got us over to the right system, we'd have been there 20, 30, 40 years ago. So that just isn't enough, right? So Bill can answer the question in terms of statistically, but you know, we got to go. It's got to be a movement. That's the only way it can go. So it's not going to be enough to have the healthcare providers.
Totally with you.
I would say in the pre-hospital, the ratio is probably a little bit lower on the Medicare for All supporters until they spend a day on the ambulance with me and I've talked their ear off. But yeah, I would say it's somewhere around 50-50 in the pre-hospital. But when you get down talking to where people stand, almost every time, I would say 90% of the time they come right around and they agree with most push on them.
And Ron?
Well, I mean, as Bill and I can attest from our work in Physicians for a National Health Program and others, it's a struggle, certainly among physicians. And I would say we lag nurses. I agree for sure, but I agree and probably first responders. I agree with what Katy said, which is it's not that you have to convince every one of those folks, but I do think there is people listen to important, people involved in healthcare, and they care what some people think. So there needs to be like a critical mass, I think, within those fields. And I think you're seeing some of that shifting. And also like a lot of students who are like more oriented to it. We have great like student affiliates of our group who are really building. And then, but even things like the American College of Physicians just came out in support of Medicare for All. It's like a pretty big physicians group. Like not, so there, and then whether the fine points of one system versus another would bring some people in. There's certain ways of having that conversation that may be better than others. Like I know some very quite conservative physicians who are just like, you know what? Medicare pays me within a week. And every other thing with all those insurance companies, I struggle with them for months and months and months, and it drives me crazy. And I have to hire a bunch of billers and stuff like that to deal with them. And so there may be some aspects of the system that get more folks from that, but it's the public who needs to want the right healthcare system.
So the only thing everybody hasn't already said is that physicians specifically poll the same as the general public. So if the general public is 69 or 70% on board for Medicare for All, physicians are too, as a block. And that's surprising to a lot of people because they think that physicians generally are more conservative, they're more interested in making big bucks, all that stuff, paying off student loans, which a lot of that is nonsense, frankly. But when you poll physicians, they poll about the same as the general public. If you poll primary care physicians, they poll much better. So they're about 75% on board family doctors, general internists, pediatricians are woefully underpaid in this country, just like teachers are underpaid. And ER doctors pull at 90% in favor of Medicare for all because, you know, it's guaranteed payment and guaranteed follow-up. Patients would be seen by their doctors for follow-up and get good care, better care, not have to come in for stupid stuff, right, Dr. Paul? So I think that's the answer to that one. I think we can have one more question, Nina. Looks like.
Sorry. Yeah. So we have like 2 more minutes. I don't know if that's enough time for a question. We should probably wrap up, I'm thinking. I did, Katy, I know she sent me some photos. I was wondering if I could show them for her. We could spend the last couple minutes just to look at them. Do you want to do that, Katy?
Oh.
Does that work for you?
I think you can
Yeah,
share
I'm trying to
your screen.
unmute. Yes, that would be
Okay,
fine,
yeah.
as long as everyone else is okay with that. I don't want to, like, you know.
Well, I figured we could just quickly do it and then, you know, I don't know, and then wrap up. It will be a good way to wrap up. So can everyone see the screen?
So these are some of the actions that we have been doing, and some of the you know, kind of deepening education to the nurses. Obviously there's straight up, but then there's the bigger picture of the nurses, of course, supporting Medicare for all. Some little digs there. I love this quote. That was a Bernie Sanders quote, and one of the nurses holding up that sign. Very clear understanding on the nurses about the implications of race and racism in healthcare, especially where I am. That was also at our BLM rally.
There you are.
Yep, that's me. Great quote by Asada Shakur.
Totally. I like this one. Okay, that's all of them. So anyways, I just wanted to do that real quick. And do we want to do a cheer here too? Coming up, we have Should We Stay or Should We Go? Which sounds amazing. I highly recommend everyone stay on to watch that panel. It's going to be about, should you stay in the Democratic Party, or what are our options at this point? I know we all agree there's some issues with it. So what should we do? So stay for that panel. It's coming up next. And maybe let's do a cheer. Any recommendations?
Medicare for all now.
I think, Katy, you want to unshare your screen, although it's a great shot.
Oh, yeah.
Oh, how do I do that?
No, it was me. I was sharing the screen. We're good.
I think I had control.
I thought it was a great shot. I wanted to leave it on that.
Medicare for all. Medicare
for all.
Medicare for all. Medicare for all. Medicare for all. Thank you, everyone. You guys rock.
Thank you, everybody. Stay on for the next one. Thank you.
Thanks, everybody.
Thank you. Just the best people ever. Woo. Love you guys.